Hi guys, Jordana Moerbe here with American Pets Alive. I am the medical program advisor, and I wanted to talk to you a little bit about surgery and spay-neuter and give you an update about what is going on at Austin Pets Alive right now. So at Austin Pets Alive, we are following the 90% social distancing guidelines that has been recommended by doctors and the government. And because it's super important that we don't contribute to the COVID crisis. So all of the decisions that we're making are with that 90% social distancing in mind. So we have entered a new era of no spay neuter, which is, it's been a little bit scary to all of us, but to be honest, we're at the point where it's okay. At this point, we really don't care. It's the least of the problems in the world right now. And we'll address the ramifications of that when we can. But right now we just kind of don't have the luxury to look that far forward, I feel like. So at Austin Pets Alive, I will say, the first thing I want to say is we are still performing life-saving surgeries. Animals that come in, dystocias, intussusceptions, foreign bodies, pyometras, those animals are still being saved and we're still performing those surgeries. We want to make sure that animal lives are not at risk during this human crisis. And so that is kind of at the forefront of the surgery controversy right now. But we fully believe that we can save those lives and do it in a way that is safe for people and do it in a way that is not contributing to the PPE crisis. And the other group of surgeries that we're still performing on a very, very limited basis, it's a case-by-case basis really, is spay-neuter. So with the 90% social distancing, we have all these animals in foster, right? If we have any animals that are at risk from being returned to the shelter because of unwanted intact behaviors in the home, those are animals that we will do our best to spay neuter, because the more animals that we have coming back into our shelters, the harder it is for us to practice that 90% social distancing, because that means that more staff have to be on site to care for the animals that are being sheltered, which is in contradiction to everything that we're trying to do. So if we have any animals that fosters are being reported to us that are spraying in the house and they're having a big problem with it, in heat behaviors, or if they're at immediate risk for reproducing in the house, then we will try to get those animals in for spay neuter and do our best to prevent that return to the shelter. Again, PPE, we want to make sure we're not contributing to the shortage, so we're reusing all of our PPE and being very careful with it. Surgery and drop-off really isn't a problem because we're doing it in such small numbers. It might be 1 a day, it might be 2 a day, if that. So it makes not interacting with people pretty easy. And our surgery team is working kind of in isolation in the back room. We have a spay, neuter, and surgery protocol in the preparedness guide that I would urge you to look at if you have any questions or concerns about this. You can also email us at inquiries@americanpetsalive.org, or you can email me, jordana.moerbe@americanpetsalive.org. I hope this helps. Stay safe and we'll talk soon.